Enteric fever. What is enteric fever? How are they classified? What are the clinical features associated with enteric fever? How is enteric fever diagnosed? What preventive measures can you take? Enteric fever is an acute systemic illness characterized by fever, headache and abdominal discomfort. Typhoid, the typical form of enteric fever, is caused by Salmonella typhi. There is a similar but generally less severe illness known as paratyphoid is due to infection with S. paratyphi A, B or C. Enteric fever usually has an incubation period between 10 to 14 days. This means an individual may show no symptoms of infection until about 10 days after the bacteria must have invaded the body's system. Over 17 million new cases of enteric fever occur worldwide, mainly in India and Africa, causing 600,000 deaths per year. Most human diseases are caused by the bacteria belonging to the subspecies Salmonella enterica. This figure represents a typical example of Salmonella enterica cerevar typhimurium, which is a gram-negative, rod-shaped, motile bacilli that moves with the use of its flagella that are paratrichously arranged around the cell. The H antigen is a protein associated with the flagella, while the O antigen is associated with the cell wall. The V antigen is a virulent capsular polysaccharide, and increases the virulence of the organism. Classification of Salmonella. Salmonella are classified as either typhoidal or non-typhoidal, based on their serotype. Typhoidal Salmonella causes typhoid and paratyphoid fever. Examples are Salmonella typhi and Salmonella paratyphi A, B, and C, while non-typhoidal Salmonella causes gastroenteritis and food poisoning. Examples include all other serotypes of Salmonella. Clinical features of enteric fever. The onset of illness is insidious and nonspecific, with intermittent fever, headache and abdominal pain. Physical findings in the early stages include abdominal tenderness, hepatosplenomegaly, lymphadenopathy and a scanty maculopapular rash. Without treatment, serious complications can arise, usually in the third week of illness. These include meningitis, lobar pneumonia, osteomyelitis, intestinal perforation and intestinal hemorrhage. Laboratory diagnosis of enteric fever. Lab diagnosis is usually done using culture. Wheatle test has only moderate sensitivity and specificity, and are therefore, of little practical value and should not be used. Definitive diagnosis of typhoid fever depends on the isolation of S. typhi from blood or bone marrow aspirate culture. Stool samples are especially useful for the diagnosis of typhoid carriers. Blood for culture should be taken before the patient is given antimicrobial therapy. 10 to 15 milliliters should be collected from school children and adults, while 2 to 4 milliliters should be collected from toddlers and preschool children. Prevention. Preventive measures include 1. Ensure food is properly cooked and still hot when served. 2. Avoid raw milk and products made from raw milk. Drink only pasteurized or boiled milk. 3. Avoid ice, unless it is made from safe water. 4. When the safety of drinking water is questionable, boil it. 5. Wash hands thoroughly and frequently using soap, in particular after contact with pets or farm animals, or after having been to the toilet. 6. Wash fruits and vegetables carefully, particularly if they are eaten raw. If possible, vegetables and fruits should be peeled. Health is wealth. Thanks for watching. See you next time.